Welcome back. Good morning, San Diego. It is a new year, and for many, this may be a time to start fresh. We have Dr. Melanie Palm here of Art of Skin MD. She is here to talk with us about how to restart your skin routine, perhaps with something new. There's a couple of new products coming out this year. If you don't want to go under the knife and do a full-on facelift, guess what? You may want to consider getting fillers. And that's what we're talking about today, two different types of fillers. Good morning, Dr. Palm. Nice to see you this morning.
You as well.
Wow, this is interesting. I was reading that you were actually one of the few dermatologists selected to study this and kind of learn the technique, the injection
correct.
technique.
Yeah, so the two new products we'll eventually get to are Restylane Refine and Define. And so the company invited a small group of us, plastic surgeons and dermatologists from the U.S., to actually go to Canada to inject this in patients before it was FDA approved. So there were a few of us that had very early experience with it. It got approved just at the end of the year. But I'd love to explain to viewers sort of how it differs from the classic Restylane family.
Please do. Because, and did I say that right? Like fillers are, you know, if you don't want to go and have a full facelift done, fillers are another option.
It is, and you know, I think, you know, sometimes surgery is needed, but we lose a lot of volume. As women, starting around 30, we lose a tablespoon of fat off of our face every year. So if you think about that compounded with some of the bony remodeling that happens sort of in our skeleton, there are changes that happen on the face. So it's not just about filling folds, you know, and especially this one that we often talk about, the nasolabial fold. It's about balancing and harmony. You know, an adult woman, she should have shadows and she should have areas of light, and she shouldn't be around little faces. So I talk to patients about what natural should look like. I'm almost 40 myself. You know, I've had some of these products done, and if you do a little bit in the correct way, you can look beautiful and natural, and we can preserve you there non-surgically for a long period of time.
Isn't that something? Okay, so show us what you wanted to show us first off.
So these are the first three products that were approved in the U.S. Restylane Lift used to be called Perlane. We have Classic Restylane that was approved since 2003, and Restylane Silk. And all of these are the same hyaluronic acid, but they're different size. So it's a particulate gel. I explain to patients it's almost like raspberry jam. But Lift is the most robust, so you can think of it almost like a sugar cube. It's a bigger particle. They sort of move it through a sieve, and so this would be a big particle size sieve. Restylane, which is the classic one and was the first one to be approved, you can think of it as like particulate sort of sugar. It's the middle ground. So it's good for sort of softening light folds. This is better for lifting.
Okay, and this is the one you just mentioned right here.
Yeah, and then Restylane Silk is the last one. So you can think of it as powdered sugar. It's the smallest particle size, and we use it to help with just fine little folds, etched in lines, smoothing the lips rather than augmenting them. If people have little fine lines, we use it there. I actually use it off-label in the forehead to provide a little bit of softening and support of volume loss that actually happens there.
Interesting. So these were the three products that
we had for a long time, and they're tried and true, but again are a little bit more granular just in nature because of how they're engineered. So now we have the same basic hyaluronic acid, but now we have Refine and Define. And what makes them different, they kind of behave instead of like sugar. Tell patients it's almost like honey. They're really flexible, and they do that because of how the sugars are actually bound or cross-linked to one another. So that imparts flexibility so that when we inject it and people are animating, they're expressing, they're smiling, they're frowning, whatever, they look more natural. And there's going to be some really interesting studies coming down the road that show that, and show that when we actually do fillers in the right way, it takes pressure off of some of the aging skin and really gets it closer to the point of more youthful skin. And so I actually wanted to show you these two products. So it used to be called Emerville. If you go to Canada and if you go to Europe and South America, this product is called Emerville instead of Restylane Refine and Define.
So this is the actual product. This is what you would be injecting.
And so the lighter one, which we use just for lighter folds, it's really flexible. So you can see I can press it and it sort of sticks between my finger and the back of my palm. So it's great for, you know, smile lines, areas that have a lot of animation. that we want the filler to sort of integrate into the tissues and look really natural. The Restylane Define, which this is the more robust one and we use for sort of bigger particles, you can see it sort of sticks to itself. It's not as flexible, so it's really good if people have marionette lines, like areas of volume loss around their chin or their jawline, or really deep folds that we're trying to give support. You can see it has a little bit of flexibility, but because it's a bigger particle size and because of the difference in how it's cross-linked or bound to itself, it's much different than the super flexible Restylane Refine.
Now, you would be the one to tell the patient
what they need,
which one would better suit them, obviously.
Absolutely.
You're the professional.
And I use every single product. You know, it's not just the Restylane family. Every single FDA-approved product for injectable fillers. I think it's important if you're going to a really astute injector, a board-certified dermatologist, a board-certified plastic surgeon, they're going to use all of this because we're not all made the same. We've got this lovely artistic palette of a lot of different colors, and you have to look at skin quality, at the person in front of you, sort of what they're seeing, what bothers them, and then what you're seeing to sort of get their face back in balance to be able to select the product.
Two things, Dr. Melanie. One is, this is safe, I mean, for your skin. I know it's FDA approved.
Yeah.
You're saying this is safe. Number two, how long does it last?
So that's a really good question. So hyaluronic acid fillers are very safe. I tell patients it's a natural constituent in our skin, and it's actually what lubricates our joints. They're sugars. And we actually have an enzyme. If there was ever a problem, I always keep it for safety reasons in my clinic. And a lot of times I see complications from the outside that I can help correct. There's an enzyme we can actually inject, and it melts the filler away. So there's actually an eraser to this, which is really nice.
Interesting.
Most of these fillers are approved 6 to 12 months. If you do more than one syringe, so the more product you do, the longer it takes usually for it to sort of dissipate away, for your body to break these natural sugars down. So sometimes it persists a little bit longer. And I also tell patients, if we inject it in an area that's not moving as much, if you look at my face right now, the mouth is moving so much, that's going to dissipate away a little bit sooner than if we were to put something under the eye or in the cheek, where it's probably going to be stabilized longer. It's not as dynamic, and it's going to persist a little bit longer over time.
Very good. And the difference between a filler and Botox?
Yeah. So that's a really good question. I get asked that a lot. So Botox relaxes muscles, so it helps with wrinkles of facial expression. So most commonly we use it for angry 11s, for the little forehead lines.
Is that what it's called, an angry 11?
Isn't that cute? Yeah. We call it glabellar lines. Yeah. But I use it a lot all over the face. We can use it for facial shaping and sort of the jawline if people have TMJ or they're gritting their teeth. It helps with those muscles. We can actually use it in some of the glands along our jawline. It helps rejuvenate the neck if people are starting to get bands. There's a lot of cool applications, but it relaxes muscles. These fillers are used to restore balance from volume lost on the face, so it helps with contours.
Yes. The balance there.
Yeah, and I think something else important to sort of talk to patients about is you really want to see what the qualifications of the person is that's injecting it. You know, are they somebody that is involved with studies? Are they somebody that's teaching other physicians how to inject? When did they get the product?
Sure.
Like, we were one of the first 20 or 25 accounts across the U.S. to be able to get this and supply it for patients. And then I think, how are they getting the product? I am never ashamed if a patient asks me to see the box, to see the seal,
like
to see the product.
From? Or even to ask you questions about your training.
You know, and if somebody gives you rebuff on that, I'd really sort of think twice about that. You know, you want somebody that's on your side.
Yeah, do your homework, folks. Dr. Melanie Palm, thank you so much for dropping by and explaining all this to us. If you want more information, we'll put a video recap of this segment on our website, KUSI.com. Love that.
Thank you.
Have a wonderful day.
You too.
And we're taking a quick break here on Good Morning San Diego, and we will be back with more.